Hello again, dear Penn Live readers. It's so nice to have you here with me again. This is Joyce Davis, the opinion editor for Penn Live, and we have an exciting show today. I certainly am excited about it. I worked for, as some of you know, for 5 years or more with Eric Papenfuss, who's the mayor of Harrisburg, and those were fun times, weren't they, Mayor?
They absolutely were, and it's really good to see you, Joyce.
It's good to see you too. So the mayor is here because guess what? He's mayor of our capital city, Pennsylvania's capital. And select cities all over the country, guys, you know that these cities are reeling from the economic impact of COVID-19. And that's what we're going to talk about. We're going to talk about the economic impact. We're going to talk about, of course, the medical impact, because this is a predominantly Black city, and it's a city with a large percentage of people who live under poverty. And so they're hitting it. I mean, they're getting hit hard. So with that, I'm going to once again turn to the mayor and just ask him overall to tell us what the city is facing, whatever he sees as those top issues, and we'll start there as we wait for our questions. So welcome again, Mayor.
Okay, Joyce, thank you. Thanks for having me. Let's start with the sort of larger impact question of how is this health emergency affecting the city's finances and the city's budget and the city's ability to deliver essential services. And in many respects, Harrisburg is like any other city in Pennsylvania. We do have one defining characteristic which sets us apart, though, and that is that it wasn't long ago that the city faced the brink of bankruptcy. We had our own sort of self-created crisis where the city's debts all came due, and we went through a period of receivership, state control. And one of the lessons of that was that we needed to build up a sizable rainy day fund so that if we ever had a crisis in the future, we'd have something that we could draw upon. And I'm very pleased to say that at least we're entering this crisis with a large cash reserve. We had our largest reserve ever in the first quarter of this year. It was over $20 million. Which is a sizable portion for a city that, it's about 20% of the yearly budget. We also were exceeding all of our projected revenues for the first quarter. So we were seeing job growth. We were seeing the economy was really doing well. We were seeing increases in how much people were earning, in how much they were spending. And that is the context with which we entered this sort of unprecedented crisis in March. The other thing is the city receives a lot of its yearly revenues up front, mainly in real estate tax payments. People pay during the discount period, so they pay early in the year. So when the crisis hit, a lot of those revenues had already been accounted for. That said, we are already starting to see what is going to be an enormous financial impact, not just for Harrisburg, but for other cities. You can see it very directly in things, cities like ours, third-class cities in Pennsylvania. We receive revenues from things like the hotel tax. Well, yeah. Of course, nobody's staying in hotels, so that's going to be hundreds of thousands of dollars that is going to be less than expected by the time the year is out. We in Harrisburg receive an awful lot of our revenues from parking. We receive it both from a parking tax that's paid, as well as a profit sharing arrangement that we have with the parking system. It was part of how the city rebuilt itself after receivership. Well, all of those payments are in jeopardy. As you may know, one of the responses that we've had in the city to make things a little bit easier for residents has been we've had a moratorium on parking enforcement, which means there haven't been people ticketing, and the meters have been essentially free. The financial result of some of that at the end is that there's no profit sharing to go back. So that is also millions of dollars in revenue, several $1 million over the course of the whole year. So those are just examples of immediate revenue sources. And then if you look at the larger ones, businesses pay a tax based on their gross receipts. The more businesses you have closed, the less revenue they're bringing in. People pay an earned income tax based on what they earn. The more people that are unemployed, I see. We're approaching in the city of Harrisburg. I don't have the exact numbers, but 30% unemployment would not surprise me. And it is a significant financial hit that all cities are going to have to deal with as we move forward.
Absolutely. Well, if there's one thing I do know about you, having worked with you for these years, is that you're extremely budget conscious, that you're
Yeah.
watching the numbers very carefully and responding to them. So I guess we'll start by, I mean, you've already indicated you see millions of dollars of a shortfall. So I guess how have you responded so far? Are you looking at any furloughs? Are you looking at cutting back services? I mean, what are we looking at?
Yes. So the city of Harrisburg has had some limited furloughs. We furloughed about 11 employees. We did that a few weeks ago. These were employees that were unable to telecommute. The first thing we did was we took any employees that we deemed able to telecommute. We sent them home. We provided them with the proper IT infrastructure to be able to do it, and they've been working from home. All of our essential employees, whether it's police and fire or public works, sanitation, all those workers have been coming to work. So they've been continuing to do their job in the midst of the crisis. But there have been some employees, like codes inspectors, for instance, which they're not going to be going out and doing building inspections or rental inspections. So we had to furlough some of our codes inspectors. And so that's been a little bit of a savings, but the main thing that we've done is we put in a hiring freeze. We actually had a number of employees that were scheduled to start work at the city at the end of March and April, and obviously we can't do that when City Hall has been closed and we're sort of working in this virtual world. So we've had a hiring freeze, minimal furloughs, those together. The estimate is that's saving us about $50,000 every 2 weeks in terms of payroll. So that adds up. That's something which is significant there. And we're very carefully monitoring the situation to make sure that we don't spend in excess of what's going to be coming in from a revenue standpoint. A lot of our big spends were construction projects, were capital projects. And until very recently, when the governor has allowed construction to continue, all of those were on hold. So effectively, we hadn't spent any of the money that we were going to be spending on this project or that project. Now, that started to be relaxed now, and companies are coming back to work. If you're in Harrisburg, you'll see work on McClay Street, for instance, or up in Mulder Square. You will soon see private work going on the federal courthouse and maybe the state archives and another building that's being built. But there was a period of time there where there's for a month and a half, 2 months, where there was no construction. And that's been a bit of a savings to the city's budget as well.
Well, I'm going to come back and continue talking to you about the economy, but let's take a few questions that are in here now, and then and I also want to talk to you about the health issues as well. Nina, I believe that's Nina, is saying that because the schools are closed, will we be paying school taxes? Schools now have been closed until fall for 6 months. So how is this impacting the property taxes?
Wow. Okay. And let me answer that in two ways. Let me start by saying one of the very positive things that has come out of this crisis has been a very good working relationship with the Harrisburg School District and the city. Very early on, we went to the Harrisburg School District and we opened up our public television station, Channel 20 in the city, which can be watched by everyone in the city and even in the surrounding municipalities, to school programming for the district. So right now, we are interrupting that program on Channel 20 to simulcast this live talk with you. But on a daily basis, you have programming in reading and arts and math. And it's all geared towards the younger grades in the school district, and that's been good to see. Now they have done more in terms of distributing laptops and trying to do an outreach for virtual instruction. But their own internal surveys in Harrisburg, and this speaks to the larger issue of what you're talking about, of how this is affecting poorer communities and urban communities where we don't have the same resources that suburban school districts have. They've focused on a partnership with the city and a partnership with WITF, and they're using television more so than computers as an online sort of learning environment. But on the tax issue, just for a second, so the city basically extended the period along with the rest of taxing entities on payment of taxes. The school district is a little different because they set their budget usually now for next year, and the school taxes would come out earlier. Would come out about halfway through the year, and then you would begin paying on those school taxes. They have not set their budget. I can't really speak to how this crisis is going to impact the district, but let's imagine that it's going to be significant for all districts. We will have to wait and see what the school district does. Property taxes collected by the city, however, we've said that we'll give people all year to pay them. Normally, there's a penalty period, there's a prepayment period and a flat period and a penalty period. And we have said that we're going to waive all penalties and fees as long as you can get them paid by the very end of the year. You won't be penalized in any way. So we're trying to extend the time period where people can make their payments. And by doing that, I think people are going to be perhaps making their payments a little bit later than usual. And that's another one of those factors that's something that we have to monitor that's different than in years past.
Got it. Let me address something that David's bringing up. David wants us to have masks on. David, let me explain. I am in my house. I am in my office. The mask guidance is if you're going out into public and you expect to be around people, then you wear your mask. And I think you guys recall that you wear your mask because it keeps you from spreading the virus. If I were to have it and not know it, the mask would protect me from spreading it. But I am here in my home with only me, and the mayor is in his office. So that's why we don't have masks. So I just wanted to deal with that because he seemed to be really upset about it. And I didn't want him to go on and continue to be upset.
And Joyce, I'll add, when I drove into City Hall this morning, I didn't wear my mask while I was in my car, but when I got out of the car, I put my mask on. I said hello to some police officers and others that were entering, that area around City Hall. I came into the studio. There's nobody near me at the moment. I took the mask off so that people could hear the proper enunciation.
But let's talk a little bit. I'm glad you brought up the police officers. And of course, dear to my heart, the police and firemen. Having worked with them, I know how dedicated and how hard they work. Chief Interline and Commissioner Carter are just national heroes to me. But what I want to talk to you about is just how are they doing? I mean, clearly they're on the front lines as well. They're having to respond to things. Any coronavirus cases, I'm assuming no deaths, right?
Oh no! Yes, no deaths. We did have a police officer contract coronavirus, and it was an interesting experience for the city. We put in place a whole series of protocols. They do regular temperature tests and other things at roll call now, but nonetheless, we had a police officer that got coronavirus. They were quarantined. They stayed at home. It was difficult for them, but they made it through it. And actually, that officer is now back at work, which is a good story. And they've been able to persevere through it. On the fire side of things, we have not had any issues, and we're very conscious of that because the fire stations are basically homes and houses where people are in very close proximity. And if it were to get in and spread, it would spread very quickly. And we've been very fortunate, but they have enough personal protective gear. They have been taking proper precautions. They've got excellent leadership, and that's been good. Here's an interesting stat that maybe not everyone knows, which is that during this pandemic, actually the call volume has decreased for both police and fire. If you think about it, a lot less accidents and EMS calls and emergency responses that fire is getting called out to because there are fewer people on the streets and actively out there. So that's made it a little bit easier for them to focus on sterilization and sanitization of their houses and keeping everybody safe. And same thing has been true for the police, but we are out there on our regular platoon shifts doing all that needs to be done. And speaking on, I can speak to sanitation as well and public works. So all of our public works employees are considered critical and essential employees, and they are out there picking up trash at 5 a.m. or earlier throughout the city. That hasn't slowed down at all. They wear masks when they are out in the public. We can also put in our parks maintenance crew, which has been out there mowing the grass so that people can continue to recreate. We shut down the basketball courts, but we haven't shut down the walking paths because we want to encourage people to get exercise, practice proper social distance. But surely going on a walk in a park is a good thing amidst this pandemic. So that requires employees doing their jobs, and they have been out there selflessly dedicating themselves in the midst of this crisis, and they really deserve to be saluted.
I would be surprised if you had said anything but Aaron Johnson and Dave are not out there at 5 a.m. in the morning. That's their life. They are so dedicated. You really are blessed to have some really dedicated people working with you. But I'm assuming that throughout this time, City Hall really has been closed. People haven't been able to work. Now so we're now starting to think about when things are open. And that brings us to Ronnie's question, who says, everywhere they've opened up, the numbers have tripled. I don't understand why people are asking to still open up. So as you're thinking through this, now you're a businessman as well as, as a government official, how are you thinking through when is the right time for Harrisburg to reopen?
Boy, that's the question that's on everybody's mind, and we can answer that in a lot of different ways. Let me start with City Hall. So we closed City Hall immediately upon the outbreak of this crisis, and really people haven't been back except for a select number of people. We've increased our maintenance crews and the cleaning and the sterilization that we do within the building. But basically, Treasury will come in sort of staggered shifts to process the bills in the mail that's coming in. Finance will come in, but people who can work at home and can telecommute are doing that. So the impact on the building is relatively low at this time. One thing which people should know is that as construction begins to open up in the city of Harrisburg, we are still processing building permits. We're still processing planning requests. And we've had a drop box at City Hall where people can drop the information. It's in the back of Treasury where there's a free 15-minute parking space. I want people to know that just because we're closed doesn't mean that the business of the city doesn't continue. And we've had Zoom meetings and planning meetings. We've approved all sorts of plans. So the commerce of the city is going on. If you look citywide, go ahead. No, please.
Yeah, you've been doing city council meetings, right? And you've been doing your conversations as well. So that's keeping you connected. Yeah. Yes,
in fact, we are live on the city's Facebook page right now, and I've been doing a community conversation series every Friday at noon, and we've interviewed people from leaders of nonprofits in the community to major stakeholders to doctors, you name it. It's been an interesting period of trying to get information out to the public. We've also done old-fashioned mailings to try and reach people that aren't connected to the internet. In a city like ours, that's very important. But back to the question of are we opening too soon? I know that there are people in the city that just want everything to go back to normal, but at the same time, we're taking a very cautious approach. I don't anticipate Harrisburg shifting into yellow for some time. I certainly don't see business going back to normal anytime quickly, and I think a go slow approach is the right approach. I do think there were some concerns about construction, specifically construction having been stopped. I'll note that our courthouse in Harrisburg was the only courthouse in the country where construction actually stopped, and Pennsylvania was very strict in its application of the stay-at-home order to construction. But now that has been lifted and you're starting to see construction, and we oversee this, so we're aware. I mean, we've seen excellent contractors practicing proper safety measures, COVID-19 safety measures, and I think that is safely returning. That's taken a little bit of the pressure off. But let's look at an industry like retail. Retail is not ready to open up, there's just no question that bringing people into close proximity with one another too soon is only going to cause us to take a step backwards. And we want to avoid that. As painful as it is now, we don't want to go backwards.
Yeah. So you're thinking at least another month, maybe 2 months, that we're going to stay closed down, do you think?
Yeah, at least till June, I would think, and probably longer. And I know how painful and difficult that is. So if we could talk for businesses for a minute, Joyce, we have been trying in the city of Harrisburg. One thing that we're very proud of is that we put together a sort of rapid response task force along with Impact Harrisburg, which is a nonprofit comprised of community leaders, to try and get grant funds to the smallest of the small businesses, those neighborhood businesses that are really, really suffering. Your barbershops, your other small retail stores that just have been completely devastated by the lack of customers. And even though there's been no income coming in, their bills have been continuing, right? They still have bills. They still have to pay the rent. They still have to, pay for inventory and basic. And they may be trying to continue to pay their payroll. This is so difficult. So we put together what I think is a model potentially for other cities, a grant fund for these small businesses. It's almost a micro grant. We capped it at $10,000 in terms of an application. So it's not a major grant like you would get for like the payroll protection program or something from the Small Business Administration, but it's enough for a very small business to be able to maybe make it through. And our goal is to see if we can help these businesses not close before it's time to reopen. We talk about reopening, but we've got to help them make it through until that time. And so, yeah,
this is money coming from the city itself. This grant.
Yeah, it's a combination of money from the city and money that was in the custodianship of Impact Harrisburg. It started out as $1 million grant fund, $500,000 from the city, $500,000 from Impact Harrisburg, and now Impact Harrisburg has added more money, and the city is proposing adding more money, as we see that the needs are so great. This today. So,
and how would someone know about that program?
Okay, so we got the word out on the program. We sent a letter to every licensed. So it was a program for licensed businesses in the city of Harrisburg. So we sent a letter to every licensed business in the city of Harrisburg, encouraging them to apply if they were impacted. We got a staggering amount of data back. So we've got about 1,800 small businesses in the city of Harrisburg. We had hundreds of them send back impact statements, narratives, and financial details explaining just how the virus had impacted their business. And really, unless you're a grocery store, your business has been down and is down tremendously across all sectors. We are going to be awarding today an initial round of grant funding to 350 of those applicants. That notice is going to go out today and tomorrow, and those checks are going to be distributed next week. And that's a pretty rapid turnaround here for grant funding. And as I say, we're looking to sort of refill for a second round. There's talk. One of the things you said is there going to be any type of relief from say the federal government or the state government for cities like ours? And I certainly hope there will be. And I know that Congress, in particular, I heard Nancy Pelosi arguing eloquently on behalf of cities and her constituents for this today. There's a need for a new stimulus bill that is going to provide sort of direct relief to cities. The one relief which has come through the Community Development Block Grant Program, CDBG funding. And there was in the initial CARES Act, there was additional money for what we'll call CDBG funds going to cities like Harrisburg that distribute those funds. So one thing we've seen is about $1.5 million in extra federal money through the CARES Act going into that program. And some of that money we'd like to apply to this business fund. Others of that money we want to apply to essential public service providers in the city of Harrisburg that have been very effective. And then there's money for our emergency service providers who are dealing with massive increase in homelessness and other needs that are in the city. So this is an unknown, but I certainly hope that Congress will get together and reach consensus on that, because it's just so important for cities really throughout Pennsylvania.
Well, I want to come back to talk to you about some of this. Particularly, I got to get to the health thing and testing and all of that. But Jack is saying he doesn't want a parking ticket. So we heard you say that you're not enforcing parking. Do you have a timetable how long that's going to last?
Yes, parking seems to be the question that is on everyone's mind. And actually, to be fair, it was something we were trying to take off people's minds as something they just shouldn't have to worry about when we've got so much else to worry about. If you're home from work, you shouldn't have to get up and move your car because there's going to be a street sweeper coming. So basically, the answer is we extended the moratorium on parking enforcement for the length of the city's emergency declaration. So not until I lift the emergency declaration will we start enforcing parking again. And that certainly wouldn't be until after the yellow stage. It's not going to be just because we switched to yellow, but it wouldn't be till after that stage. So as a barometer, the first thing they'll see is Dauphin County and the city will switch to yellow. The second thing they'll see is probably a gradual opening up of City Hall and a removal of the emergency declaration. So not yet.
When you reopen, do you consider that the initial stages might involve reducing the numbers of people that you might allow in bars or restaurants? Are you thinking that far ahead yet to say that, well, when we do reopen, we can't have people close together anymore? Or we have to, are you thinking in terms of any restrictions that might have to be placed?
Oh, yes, absolutely. That's now the city is generally following the recommendations and guidelines of the state. It's not like the city is going to have a different set of guidelines, make it more confusing for businesses. But I know that the one model would be to, for instance, allow restaurants to reopen, but limit the number of occupants that can be going at any one time. If that happens, there are ways that a city like Harrisburg can maybe help and adjust. And we've been talking with the Downtown Improvement District and a number of restaurateurs about perhaps temporarily or at certain times shutting down some streets in Harrisburg, allowing people to have al fresco dining or be outside in a wider space separated from one another rather than in the narrow confines of a restaurant. We're going to do what we can to help these businesses transition back into being open again. And anything that the city can do to make it easier, I think, is important for us to look at.
Okay, let's take some more questions. Tyler is one of our more provocative thinkers. He's always here with me. He wants to know, why don't you legalize weeds? He says, we got bills. Stoned people tend to naturally social distance by staying in to watch TV and eat Hot Pockets. I guess the issue here is, are you doing any kind of creative thinking on what might bring in additional revenue during this time? And Tyler's focusing on legalizing recreational marijuana, I think.
Okay, well, I hear you, Tyler. A couple things that you should know about the city is that we did decriminalize marijuana possession. That was something that we were on the forefront of in terms of Pennsylvania cities. And we also have worked with the state to allow for the medicinal marijuana sales to sort of take place in the city. And that's been a revenue source and a licensing source for the state. So we're not there yet in legalization. If we were, it wouldn't be a city issue. That's something which really has to be done on the state or even the federal level. Actually, cities are very constrained in Pennsylvania in terms of revenue sources. This is something that I think will be part of a broader discussion on the state level as we move past this, which is that we don't have the tools to be able to sort of supplely respond by implementing a new type of tax here or a new type of fee here. What we can and can't do is very much controlled by the Commonwealth. And in Harrisburg, we've been having trouble keeping. One of the battles has been, can we keep the revenue sources that we have that are working right now? And hopefully the culture is going to come to an understanding that now is not the time to take away existing revenue sources. It's the time to be creative and to look at potentially new ones. That's not to say that we, in the midst of coming out of a crisis, we suddenly want to put new fees and taxes on people either, because the economic impact is so vast and great. If anything, we're going to need to be assisting homeowners and residents and business owners in their ability to pay the taxes which are currently there. So that was a long answer to the question of legalization of marijuana, but it does speak to the broader issue of, unfortunately, mayors can't take an idea like that, and even if that were a good source of revenue, and implement it unilaterally.
Absolutely. So Cheryl was asking a good question that leads us into what I want to talk about. She wants to know what the city is doing to try to contain the spread of the coronavirus. So what do you know about the impact? I mean, how many people do you know in Harrisburg have contracted it? Do you know how many people have died? Just give us a sense of what you might know about this spread inside the city.
So one thing which I know is a source of some debate and contention is that we don't have a breakdown of Harrisburg versus Dauphin County per se. What we do have is an ability to look by zip code, and you can see the number of cases and deaths by zip code if you go to the Department of Health's website, and that can give you a general sense of where things are. I know first responders have been very much in conversation with the Department of Health about trying to get information that will help them do their job safely. For instance, if you're going to a call, you know, they would find it valuable to know if somebody was in quarantine at that location, or if and you have to balance that with protecting people's rights to privacy. That's just a means of sort of complicating the numbers. We don't have a totally clear sense of exactly what the numbers are at any one time. We do know, however, that and I think we all know people that are infected. I know people who have unfortunately died of this virus in the city of Harrisburg, and we also know that if we open up too soon, and this gets to the heart of the question, we're just going to make it worse, and we're going to go backwards instead of forwards. So what we're doing, the question was, what are we doing in the city? What we're doing is we're not rushing it. We are following the governor's guidelines, and we're taking a go slow approach to opening it. And we're gonna model that with City Hall and city operations, but we're also not gonna jump the gun and try and rush people back to work when it's not time yet. You asked me if it was time yet, and it's just not time yet in Harrisburg.
So Michael is asking, do you feel the federal government is dragging its feet in the ways of a new stimulus bill, especially since they still have no clear-cut plan for reopening the economy? He says that's not a problem, but there's a lot of people who have. So basically, I think what we're trying to get at here is, do you believe, or would you like to see the federal government do more to help the states as well as the city?
Yes, absolutely, and that's why this new stimulus package that's currently being debated in Congress right now is so important, because this is the bill that now has the potential to directly fund states and municipalities, and that could plug the gap. We started this conversation talking about the millions of dollars that are going to be lost there, and if we could plug that with a one-time stimulus for this year, that could help us get into next year without things getting worse, without there being pressure to increase taxes on people, which nobody wants to do or contemplate, or to lay off first responders. That would be the last thing we would want to do in the aftermath of this crisis, when they've worked so hard and they've done such a good job of keeping us safe. So there is a need for a new federal stimulus. We could talk a little bit too, because I've got an interesting perspective on the previous stimulus as well. One of the things that is interesting is that they passed this payroll protection program, but they did so with sort of an unrealistically tight timeline for trying to get people back to work. So I know businesses in Harrisburg, for instance, that were the lucky ones. They got the payroll protection program approved because they were in with their bankers early on with an application, but they had to give it back because they couldn't spend the money in 8 weeks. Basically, the way it works is if you receive the grant and you spend it in 8 weeks on payroll, it can turn into a grant as opposed to a loan. Let's take a restaurant, for instance. I know a restaurant that got this. They can't bring their servers back and have them work. There's no revenue to sustain that, and it wouldn't be the safe or the right thing to do. So on the one hand, you have the Payroll Protection Act encouraging these businesses to reopen, and that's some of the pressure to reopen. It's coming from this stimulus program, which is encouraging them to spend the money within 8 weeks. And then on the other hand, you also have this interesting dynamic, and this is happening in Harrisburg, where there has been an increase in a sort of bonus for unemployment payments on the, so basically you get this extra unemployment payment through July, which is really not an incentive to go back to work, and then runs counter to the payroll protections program. So you have businesses that are trying to bring their employees back, and employees that are making more on unemployment and able to be safe and not put themselves at risk. And rightly, I think, are saying it makes more sense for me to do that. And these are some of the mixed messages that we've sort of sent with our various stimulus packages on the federal government. So it speaks to the question of, I realize everyone's trying to help, but sometimes some of the things that they're doing run contrary to other things, and it makes it hard.
Yeah. But let's talk now a little bit about, Shirley is raising the issue, this angst that I think you've heard a lot. I mean, people who are essential workers, or people who simply are working jobs that are cashiers or meat packers or any of that, they can't stay home, and they are getting sick. And I'm sure that we're dealing with, for those who are working in Harrisburg, a large percentage of people who are dealing with the fact that I have to go to work. So I guess this is getting to talk on behalf of those people, but also, do you feel that there's enough testing to be able to identify and to help people know if they have the virus, if they might be spreading it? Because one of the things we all know, you may have the virus and not know it because your body just can simply handle it, but you may spread it to others. So are there enough testing places in and around? I mean, I don't know if Hamilton Health is a testing center or if there's any UPMC places. So talk about the facilities that are to help people.
Okay, so we've got testing, and then you have these sort of frontline workers that are having to come in and work these essential jobs, and leaving police and fire and emergency responders. So start with that, leaving those aside, because I think they knew what they were signing up for when you become a police officer or a firefighter. You know that you are signing up to put yourself in harm's way for the good of the community. When you work at Giant or Carnes or Weiss, I'm not sure you ever thought that was going to be part of your job description, but it certainly is now. And we have hundreds of workers that are going to work at these essentially minimum wage jobs and higher, and every day putting their lives at risk. I will make this personal because I've talked about it a couple of times on our Facebook Live, but I have. My brother is disabled. He has some health issues, and he is a cashier at a grocery store, and he's probably as at risk as anyone could be for contracting the virus. And yet, not only does he need the money from his job, but he also knows that people are relying on him to get their basic goods and services. He's taking great pride in being and helping people during this crisis, and that should be commended. It should be rewarded. And I absolutely believe in the concept of hazard pay for those types of frontline workers. And I know Giant and other companies have increased the hourly rates during this, and there's probably more that we can do. I mean, we can't do enough for those. And I would hope that everyone who goes shopping, you take a moment and you thank your cashier. Even if you're having a difficult day and things are slow and you don't want to wait in line because you're just annoyed at how many people. Remember, these people are out there sacrificing. They are putting their lives at risk to allow you to bring food to your family. It's an extraordinary thing, and those individuals need to be thanked. We've got a sort of couple campaigns in the city. We have the Helpers campaign, and we're trying to do things to be appreciative of everyone on the front lines. Let's switch to the testing question too, because now that is, yeah. Go ahead, Joyce. Yeah. Mm-hmm.
No, I was just going to say, I want to reemphasize what you said. It's something that we're saying. It's important for people to be polite now, to show respect. Everyone's working under extraordinarily difficult circumstances and stress, and you only add to it when you're not nice. But go ahead.
I know you feel that way, Joyce, and I do too. And we could also talk a little bit about social media and how with more activity. And I understand the importance of social media, but boy, this is the time for people to try and come together and be supportive of others. It's not a time to be out there trying to shame others or just not be kind. Honestly, kindness goes a long way in helping knit a community together, and we need to have that at the forefront of our message. But let's talk about testing, because that's really important. In Harrisburg, we do have a testing center. It's run by UPMC. It is on Paxton and Cameron, but it is not a walk-in center. It is a by referral center. And it is not a proactive testing center. So it's not testing healthy people or anything like that. Out Linglestown Road, Rite Aid has a testing facility where you can go in and do a self-test and get tested. I have personally talked to the leadership at Rite Aid, and we've talked about the possibility of trying to bring more of a testing center into Harrisburg. Obviously, we'd like to see that. That is something that I think we're grappling with. Every city in the Commonwealth is grappling with. We'll need to have it. We'll need to have better testing as we try and return to some sort of a sense of normalcy. It doesn't exist. It simply doesn't exist right now, and that is what complicates this whole reentry process. Then the reliability of the tests is also another issue, which is, since you have people that are asymptomatic and can still spread the disease, it's very difficult. Go ahead.
Let's take a few more questions here. Okay, guys, we're focusing on the coronavirus here and the mayor's, the city's response. And so one of the questions coming in from Kenneth is that the testing wouldn't be a thing if y'all would stop watering down the term essential. So he is basically arguing. Frankly, Kenneth, I think I disagree with you. Testing is a thing. I think testing is key to everything. For me to be comfortable going back out to places, I need to know that people around me aren't spreading the virus. They don't have it. But essential, so I think he's arguing that there are more essential jobs in our society than we are labeling essential. But that's not a label that you've done. That's an essential label that comes from the governor and from the federal government, correct?
Yeah, I understand the concern with labeling some jobs essential and other jobs non-essential. I mean, I understand why people take offense to that because, and also why a lot of businesses that feel they're providing a real service, when deemed unessential and forced to close would be upset. But let's not have that discussion of terminology detract from the fact that essential workers should be appreciated for what they're doing. Call them critical, call them emergency. You can choose a different term, but there are people out there doing jobs, and we should be grateful and thankful for them and appreciative of their efforts.
Wonderful. And of course, people are asking, why isn't everyone getting tested? Frankly, Steve, that's the question people are asking all over the country, not just in Harrisburg. Why can't you just go in and get tests? These tests are really not readily available, or not as available as they should be, I'm thinking. So
yes, and that is, it's really a policy which is dictated from the federal government on down. It is something which is not unique to Harrisburg or New York or any other state, and it's something that we've got to fix. I couldn't agree more that we need more of it. We are fortunate in Harrisburg, however, that we do have a testing center. So if you are sick, you can be tested. But that is just not the same as a widespread, proactive, regular testing of the workforce.
Oh, absolutely. So, thank you, Jen. I wanted to say that she wants to thank us for bringing these broadcasts. Well, frankly, Jen, as long as you guys are finding them helpful and useful, I will continue to do this. This is a service Penn Live has done during this crisis to bring people important like Mayor Papenfuss, who is willing to sit down and talk through some of these very, very difficult issues. So I really appreciate your letting us know that. Now, the one thing I do want to make sure, you mentioned the police and fire. I want to keep coming back to them because they're so important to everything. They are able, I'm assuming, to get tested and to check on them and make sure everything's still good there. They don't have any problems, or even with protective gear, right? Are they getting what they need, or is there a shortage?
We have enough, and it's, you know, sometimes it's been a struggle to get it and acquire it, but we have enough. We also have enough cleaning supplies for the city, and they are able to get tested. So in the case where we had the officer that contracted the coronavirus, we knew that because they were able to get tested and we got the results back quickly. Sometimes police officers will get in contact with an individual, maybe that individual is showing symptoms. We will be able to get a response back from the hospital quickly as to whether or not that person has tested positively, and therefore whether or not we need to test our officers. And we have, as I said, quarantine procedures whereby they'll go into quarantine until we get the test results back. So that's been relatively fast. So it's different. It is different for first responders than for members of the general public.
Right. So you're not anticipating at this, so you're at full staff for police and fire, and you're not anticipating having to do any furloughs with police and fire or any layoffs, right?
No, absolutely not. And we would do whatever it would take to avoid that situation. That said, you know, most of our expenses at the city is with police, fire, and public works. That is what the city spends its money on. It's the largest portion of the budget. So if we are seeing major deficits by year's end, millions and millions of dollars in deficits, there are only, you know, there's a limit to what we can cut that isn't that, because that is the largest percentage of what we're spending. So that's where the need for the federal stimulus comes in. If you're trying to wrap your head around at home why it's important for a city to get resources, it's because if we don't, we are not going to be able to pay the first responders that are out there right now doing the work, because the revenue is not going to be coming in to be able to pay their basic salaries, which is the largest percentage of any third-class city's budget in Pennsylvania.
Right. Well, Niels is also expressing some of the frustration that we have here. And that's what I think the mayor has been speaking to, trying to get money to people who need it most. And, you know, there's just this anxiety, as you well know, because your city is again, 30% at the poverty level. People can't work. They can't get money. How are they to pay bills? But I will say, I believe you were one of the first mayors to announce early that people couldn't be evicted from houses. And it looks like that is still going on. So you want to talk about that?
Sure. Yeah, that was very important for the city. The city was planning to place a moratorium on evictions. Luckily, the governor felt the same way. The court system felt the same way. Everybody was in sync. It appears that moratorium was about to expire, but now has been extended, which is fantastic because it means that the city doesn't have to do anything that's out of step with the state and other municipalities. I had previously petitioned the court system to extend that moratorium on evictions. So our position in the city of Harrisburg is, as long as we have a health emergency, we shouldn't be evicting people from their homes. We also shouldn't be, cutting off their electricity or their utilities or foreclosing on their home. These are basic, I think, human rights to be able to live amidst this crisis. And that's certainly what we believe in the city. That's what we're practicing. And that's not to say that is different than elsewhere in Pennsylvania either, because I think we're all on the same page that we can't do that to individuals in the midst of this crisis. It only exacerbate the problem. You throw people out on the street from their home, you're only putting them more at harm's way.
So I'm going to stop it here. I'm going to continue to get, I'm sure, more than 100 questions. They're rolling in and there's lots of them. So people are interested. One final question before I let you ask questions of me, as we agreed. But what about the homeless people? I mean, that's one of the things that clearly, what are they doing right now? And what is the city able to do to help them?
Yes. So there's a number. The impact on the homeless population throughout Pennsylvania has been severe. We've seen an increase. We are doing regular outreach. UPMC does regular health checks to some of the homeless encampments that we know exist in Harrisburg, and we do regular outreach to those, and we're checking on people. We are still providing things like showers at the YMCA in the downtown, even though that can be difficult with with this health emergency. But they're taking extra precautions, and it's necessary for people to do that. We went to the extraordinary step of putting out portable sinks in all of our parks throughout the city and in various areas. Additional portable facilities, porta potties out for the homeless. So all of this is an effort to sort of help. And we've continued our food distribution, and the food bank, Central PA Food Bank, has done a wonderful job working with both our community policing department and other distributors in the area to help make sure that people have food. And all of this is part of a sort of comprehensive approach to trying to help the most vulnerable people in the midst of this crisis.
Absolutely. Well, you've covered a lot of territory here from
Sure.
economics. I mean, I'm hearing, though, and I'll turn it over to you, but I am hearing you're generally positive that the city will emerge from this and be able to get back on track. It may take, a year or two, but you're generally optimistic.
Yes, I am a generally optimistic person. That is not to say that this isn't a serious crisis that we're in, or that it isn't going to be hard, or that it isn't going to take time. But I do think we will recover, and I am encouraged by many of the acts of compassion and kindness and community building and the spirit that I see in our city, which has been awakened. I think in the midst of crisis and adversity, we've seen real heroism and community spirit, and these things will help sustain us and allow us to get through to the other side. So yes, I am optimistic for our city. Well, and just a couple questions for you, Joyce, because so for every week now for 9 weeks, I've been having community conversations noon on Harrisburg's Facebook channel, and we decided for this week we merged them. But I thought it would be interesting to our viewers just to ask a little bit about this impact on journalism. Talk about essential workers. Well, journalists were deemed essential workers. So how are you able to do, and maybe not just you, but the normal beat reporters, how are they able to do their jobs in the midst of this crisis? And I would say they are essential jobs. They are
very essential. But I will tell you the truth. When you're a journalist, it's a calling. I mean, I started journalism when I was 19 years old. And it was basically my religion for a long time until I really found religion. But it's a commitment. It's something you really want to do, and you consider it just like what you're doing is important to your people and to the city. And I felt I was doing important work when I was with you. Same here. I feel that what we're doing now, talking to people, allowing people to express themselves, to vent, is a community service, a public service. And the fundamental of democracy is that people have to be informed. So you need good people, decent people out there risking, yes, sometimes catching the coronavirus, although they're protected. We're wearing our mask when we go out. They're going to be committed to doing their job and to doing it as faithfully and as responsibly as they can. So I've been really heartened at the dedication that I've seen from the reporters and the editors, to be honest. At Penn Live, of course, but frankly, around the country, you will see them out doing the work.
Yeah, no, it's impressive, and it is interesting. The work of government continues and the coverage continues. It's just a lot of it is changing. Your industry and Penn Live were right at the forefront of this switch to digital coverage. What is the financial impact? Can you talk in general terms of the crisis on your operations? I know, for instance, you took down your paywall to make it possible for people to read these critically important stories. Is traffic up? What's going to be the financial impact on media?
Well, I'm not in the business side of things, although the new mindset is you have to be concerned and worry about everything, right? But the truth is, as we're looking at this, we're getting a complete explosion in online growth. I mean, yes, the print side, the advertising and all of that, because of what businesses are going through, I'm sure has diminished quite a bit. But I will tell you the number, I have some statistics I can give you. In April, we had 27.1 million content views. It's the best history in the best month in the history of Penn Live. So people are turning to online incredibly. even with this, when we do these things, I've had anywhere from 10,000 to 20, 30,000 people watching it. Megan Healy went out and covered the protest at the Capitol. She ended up with 1 million viewers. Wow. That's the impact that we're seeing. It's 116% year-over-year growth for content views. And all of that, of course, ends up basically making you attractive to advertisers. Once these companies have the money again, they see the potential reach. And it has gone basically digital. That is the future. It really is. And I think things like this are the future. Look, nobody wants to simply be told how to think by an opinion writer. I got great ideas, but I'm not choice. They want to engage. They want their views to be expressed. And they want to hear from people like you directly.
Yeah, I think we've found that platforms like Zoom for meetings can sometimes be even more efficient and a better use of people's time. And certainly, it sounds like for your industry that the emphasis on online communication is only going to help with the momentum that you'd already begun to build. Let's talk. Another question I had is, it's so important that people get the right information in this day and age, right? We talk about fake news, but when it comes to health emergency, not everyone's opinion is equal, and it is important to that people can trust the information that they're receiving. So how have you and Penn Live been sort of grappling with helping people understand what is and is not reality?
Well, that's exactly right. We have to go to trusted sources. Of course, one of the issues, I just did an editorial, is that we have to be able to get the right information from government officials. You've made yourself available here. We're talking. You generally are available to our reporters to talk through. We've got to get that same thing from the state government. We have to be able to, I can talk to you and you answer, and I can follow up and then I can follow up more. We need that to be able to accurately report what's going on at the state level too, which is developing into a problem. It's a problem because we need to make sure we're giving the full and complete story to our listeners. We don't want to be only giving them a little bit. It's been a problem, I know, at the national level, because I care about the nation and the world as well, because unfortunately some of the information coming out of the press briefings at the White House has not always been clear, accurate, and scientific. So that has been a problem. And things like this, one of the first things I did with the Facebook Lives was bring on a doctor who was an expert in infectious diseases, and he walked through what was going on. I also brought in a research scientist at Penn State, Dr. Kuchipudi, who is investigating and looking into how diseases jump from animals into humans so they can develop vaccines. And so he's been on twice. So we're bringing reliable, responsible medical professionals. I've had doctors, I've had nurses, I've had all on here to talk. And what is really interesting, which really touched my heart, we had the president of the local union, 1776, who really went in and talked about 7 of his workers have died in the past weeks. 650 have been infected. These are people who had to go to work. Have to go to meatpacking warehouses. So we're trying to bring people who are reliable, who are experts, who are responsible officials such as you to engage directly with people. But it's hard. It's hard. It is hard.
It is hard. Well, thank you, Joyce, for this opportunity for a conversation. I see we're approaching the hour mark, so I think we'll leave it at that for now. If your viewers want to join the city of Harrisburg for future conversations, community conversations, I hope they'll consider tuning in. You can do that on the City of Harrisburg Facebook page. You can also find all of our community conversations archived on our YouTube page, which is just youtube.com/WHBG20. So thank you again for having me. I really appreciated the conversation, and it's really good to see you. And I appreciate all the hard work that you and others at Penn Live are doing in the midst of this crisis.
Well, very good. And we appreciate you, the wonderful firemen and policemen and all of the hard workers, the sanitation crew. Yay, Aaron. Good to you guys, and continue your good work for the city of Harrisburg. Have a great day now.
Thank you, Joyce.
All right. Bye-bye.